Okay, ma'am. Uh, Hello, I'm Dr. Anjana, one of the doctors in the clinic today. May I confirm your name and age, please?
Yeah, I'm Adi, okay? I'm 30-year-old doctor.
Okay. Is it okay if I call you Eddie Goke?
Yeah.
Okay, Miss Eddie Goke, I gathered from your letter that you are here to discuss, you're planning, trying to conceive, and you are here to discuss your reports. Is that correct?
Yes.
Well, Miss Erigoke, I'd like to apologize that your previous notes are not available here at the clinic. And well, for that, I have already informed the staff and started a reporting as to why the notes are not available. So, is that okay if I ask you few questions to know more about you and that we can discuss your reports?
Okay.
So I can see that you have been trying for 3 years, and I'm very sorry to hear that. I mean, how you and your couple are coping, how you and your husband are coping from this.
No, doctor, I'm actually finding it little difficult to get pregnant. Not
Hmm.
about coping, but we are trying since last 2, 3 years, and everything has in vain. Yeah, it's taking a
Hmm.
toll on our
Yeah,
situation.
yeah. I mean, that's what I. It's really very difficult situation. I can see that you are upset, and but don't worry, we are here to help you. Eric, okay, can you tell me what kind of treatment you have tried so far?
Yeah, actually, doctor, we were not using any form of contraception from last 2 or 3 years. We tried to have our sexual intercourse around the time of my ovulations, although I do have my regular periods, but I feel that I'm having ovulation, and
Hmm.
I do have quite frequently. I am aware about this fertility period and all those things.
Mhm.
That's it,
Okay.
and I'm taking folic acid also.
Okay. And at the moment, do you have any concerns regarding your health, any abnormal discharges or pain in your tummy?
What actually no?
Okay. And when was your last menstrual period?
It was 2 week back.
Okay. And you mentioned you are not using any birth spacing method at the moment. But previously, have you used any methods?
Long back, I was using oral contraceptive pills because my periods were
Hmm.
quite irregular.
Okay. So, still, are your cycles irregular?
Yeah, they are
Hmm.
approximately 1.5 month every.
Okay. And may I ask how long you have been in this relationship?
I'm since last 4 or 5 years.
Okay. Miss Edigoke, few of my question may sound intrusive, but it is important for the aid of the treatment. Is that okay if I ask you?
Yeah,
Hmm. May I ask if you have any difficulty during intercourse?
no,
Have you or your partner been treated for any sexually shared infections in the past?
no,
And any difficulty during intercourse with you or your partner?
no.
Okay. And have you or your partner had any kids before?
No,
Okay. And are you fit and well, or do you need to visit to your GP for any medical condition?
I'm fit and fine. I do not visited a GP for any other condition.
And what about your husband?
He's also fit and fine.
Okay. And did you had any surgeries in the past on your tummy or down below?
Mm, no,
Okay. And for your partner, may I know his age?
he's 28.
Okay. And did you, what about your social habits? Do any one of you drink alcohol or smoke cigarette?
No, my partner
Me,
smokes cigarette. I do not
okay.
smoke.
Okay. So, may I know how many cigarettes does he smoke?
Yeah, he smoke 8 to 10 cigarettes.
Okay. Well, Miss Adigoke, I would like to tell that it has the studies have found that smoking does have an effect on fertility for both the woman and the man. So, as in your case, I would suggest that we can help you in quitting smoking by connecting to smoking non-NHS services, if you would like to.
Okay.
Mm.
I will
So
pass out this message to him.
yeah, and may I know your weight to height ratio?
It's 30.
Okay. And your blood group?
I think it's A positive.
Okay. And any of you, pardon me to ask, if take drugs for recreational purposes?
No, no,
Hello?
no,
Okay. Okay, Miss Adigoki. And how are you feeling in the past few weeks' time? Do you feel low, anxious, depressed?
no, doctor. Everything is fine. I don't have anything.
Okay. Good to know that. And are you well supported at home?
Yes.
Okay. Thank you, Miss Adigoke, for sharing all the information. Do you want to add anything to this?
No, I don't want to add. I'm really anxious to know what can be, means how you are going to manage me, doctor.
Well, definitely, I'm taking you to the management part, Eriguki. So before that, is that fine if I examine you in the presence of chaperone? I will check your observation and examine your tummy and from down below.
Okay.
Mm. Okay, thank you, Eriguki. So I have you and your partner's reports here with me, and I have confirmed the name and the NHS number on the report. Well, Miss Adigoke, your partner's semen report, I'm afraid I won't be able to share with you until we have his consent. Will that be okay?
Actually, he
Uh,
has given the consent, so you can
okay.
discuss.
Okay. When your partner's report it has come down to normal, I mean, it tells us the quantity and the quality of sperms, and that is normal. And although I have some concerning news regarding your blood reports. The hormone profile looks okay, Adig, okay. However, the 21 day progesterone level, which tells us that whether your ovaries are producing eggs on time or not has not come into the normal range, which means that maybe your eggs are not making eggs on time. Are you following me?
Okay, okay, okay. Yeah.
uh,
So
so
what
um
next, doctor?
your for that your care will be taken care your care will be shared by a group of doctors, that is my consultant, the infertility specialist doctor, the imaging doctor, and a counselor and a specialist nurse. And we would like to run a few more tests to see the health of the ovaries, the womb, and also we need to do further test, one more test that is called a tube test, to see whether see I can draw a diagram and show you that this is your womb and the tubes and the ovaries. So that this is the tube where the egg and the sperm meet. Sometime if there is a block in the tube, that could be also one of the reasons for not conceiving. So we need to exclude all the reasons. Okay. Are you with me?
Yes, doctor. So
So we
what
need to
next
do
actually?
yes. So where we are going to do an ultrasound scan and as well as a dye test to see the patency of your tubes. And then coming to the management part, Harigoba, so it looks like based on the information and the examination that as the ovaries are not producing eggs on time, which we called it as an ovulatory infertility. Okay, have you heard about it?
No, doctor, I have not heard
Uh,
about it.
Yeah, so basically, as based on the investigation, as the eggs are
So
not
what is the
producing,
reason for this
well,
anovulatory? What is the reason
uh,
for this
well,
anovulatory infertility?
yeah. Yes, I will definitely. I your have a valid doubt. It is because of multiple factors. It is your lifestyle, your weight, and also it has some hereditary effect. Like if your mother and if a woman's mother sister has this irregular cycles history. And one factor is the
What is
raised
this
weight.
condition is what is this condition called as? Having an irregular cycle, what is this condition called as?
Um, Having this irregular cycles, it is mm,
You have
um,
completed your time. Okay, you have
mhm,
completed your time. I will
mhm,
you can explain rest of the situation in your own word. Okay.
mhm, mhm, mhm.
Yeah. So what is this
Okay.
condition called as?
Uh, like polycystic ovarian syndrome.
Okay. Now what, doctor? Now what actually next? What will be my management? I'm really
Well,
keen to.
Mm-hmm. Well, there are three options. There is a conservative management, there is medical management, and there is surgical management. So, in the
Okay.
conservative management, we advise lifestyle modification, where we advise 30 minutes of exercise. Plus, we need to optimize your weight, for which I will connect you to a health expert to bring down the BMI into the normal range, because once you start losing 5 to 10% of your weight, it can bring the hormones into normal homeostasis, which can make your ovaries produce eggs, and it is the first line management in this condition. Are you following me?
Okay.
And then, even if after trying for the lifestyle modification strictly for 2 to 3 months, even if you don't get your periods on time, then we may need to start you on some medications which increase the egg formation, which is called as clomiphene citrate. And this medication is taken in the first 5 days of the periods for 5 days. However, it has certain side effects, like you can have nausea, tummy ache, and sometimes, after taking the medication, women can develop overstimulation of the ovaries, which can cause bloating and nausea. And sometimes there is risk of multiple pregnancy.
Okay.
Okay. Hmm. So even after trying this medication for 6 months, and if you don't conceive, then we need to go for another third line management, that is the surgical management, where we may need to do keyhole surgery and see the health of the womb and the ovaries. And if the ovaries are bulky, then sometimes we need to puncture the cyst in the ovaries, which can activate the ovaries to release eggs. Are you following me?
Okay.
Yeah.
Yes.
So, yeah, so
Yes.
ma'am,
Doctor,
I couldn't
actually, you have
finish.
told me so many options, doctor. I'm really confused now.
Well, I will give you the patient information leaflets, and so that you can read more about it, and we can discuss in the next appointment. And whatever option you choose, we will be respect that. However, the lifestyle modification is very important, which will you have to which is advised to be followed with the other two methods. And I will connect you to the support groups as well, and write back to the GP about our discussion. Will that be okay?
Okay. Thank you, doctor.
Okay. Okay, thank you for your time.
Yeah. Thank you.
So,
Okay. Your own reflection, Dr. Anjana.
ma'am, I don't know. I was quite nervous. I mean, I did prepare it. It's not like I came without preparation. Even though I was like I was repeating the things, and I don't know, ma'am. When I'm on live practicing, uh, whenever I present, I get nervous now.
Okay. So what will happen in the real exam?
That is the thing. I don't know, ma'am. Like
That is
when I
yeah, this is your
that is
first
what.
attempt here.
No, it is my second attempt
Okay. You had given last exam when?
in November.
Okay. Okay. See, why you were frightened or why you were having this problem, that must be in your mind. Come out of that block, mind block. Okay.
Hmm.
Then there are points or there are scopes to improve a lot.
Hmm.
If I wanted to give you a very critical feedback, I will not, I'm not a person who will always polish you. I will
Hmm.
say good things. I am a very,
Hmm.
when it comes to giving a feedback, I generally give a
Hmm.
very critical feedback regarding that person. Okay. So
Hmm.
take it positively. Do not take it
Hmm.
negatively. Anybody wants to
Okay.
comment on her performance? Okay. Anybody? Anybody? Do you have a now I am having a habit of asking, do you have a partner?
Yes, ma'am, I have a partner. Hmm.
Okay, who is your partner?
She is not here, matlab, in this, but yeah,
Okay.
she is also taking exam. Yeah.
Okay. Yeah, otherwise I keep on asking their partner the finding a mistakes, okay?
Ma'am,
That would
I
help you.
okay, I have missed so many things. I didn't ask the hot and cold intolerance. So I don't know if that was or
Why hot and
prolactin
cold intolerance? Why hot and cold intolerance?
or chest pain,
Thyroid.
headaches, or blurring of vision. Yeah,
Yeah, so
prolactin was
that
little on
prolactin is
higher side.
high.
Yeah.
Yeah, so that history you had missed out. Okay,
Mm.
that history you had missed out.
Mm.
The major problem is history taking. You took a history almost 6 minute history taking. After
Mm.
that, you examined me, which is another 10 second, and after
Mm.
that, explanation. Okay.
Mm. Mm.
So time management here. Time management is a biggest flaw. In the exam, whatever options you are going to tell me, you have to finish it off within 10 minutes time. No extra minute will be allotted to you. Okay, so see to it that you just need to take a quick history, which will be finished by 4 minutes, and then you will come up with the management plan. Simple, simple things like mostly closed question you asked me. Mostly closed question. Why you in the beginning only? Why you thought that I am depressed or how I am coping and all those things? Why you thought of it? See,
Mm.
it is not a task where actually you need to show a lay examiner that I'm having a very distressed or difficult situation. These kind of situations too are there actually in the exam. Which are those situations you need to identify? The situation like the patient who is having a recent stillbirth, okay, recent
Mm.
abortion, okay, sexual abuse, domestic violence, okay, or any cancer which is she's aware. So these are the situation where I will definitely ask a person, how are you coping with this news? Are you finding it difficult? Can I put you in touch with the support group? Are you in touch with the counselor? Here, because I need to show that empathy, okay, my task is to take a clinical history and manage this patient on a clinical ground. But here I will not, I will take a other way around. Okay, other way around. In teenage, yes, I will take other way around. In this simple task, why you asked me, why you wasted your initial time. So that has almost costed you. Then there was multiple closed question, multiple closed question. Here you need to take a very simple history. Okay, closed question. I told you regarding my sexual history. So only few questions could have been better off. Dyspareunia means ejaculation means any difficulty while having a sexual intercourse, and any problem with the partner. Okay, any problem with the partner, that's it. You can complete that sexual history. Now, menstrual history, LMP, irregular, not irregular, history of PCOS, weight gain, excess hair. Yes, I do have a weight gain, I do have a excess hair. Okay, I'm having headache recently and my nipples are having discharge also. That is another history. And at least when you cannot you cannot remember it at the beginning, when you have seen that prolactin report, at least at that point you need to ask me these two questions. Do you have any headache recently? Have you changed noticed any blurring of vision, and have you noticed any breast discharge? Okay, breast secretion. So at least you know that this is okay, some concern regarding the prolactin secretion, which is very important here. Then too many irrelevant questions. I don't understand why you keep on asking me those irrelevant questions. Examination, I keep on telling all of you, whenever patient come to discuss the report, no need to offer them an examination. In NHS, they do not offer an examination. Okay.
Okay.
Yeah. BMI is important. Blood group is not important here. Hmm? Blood group is not important. Checking my knowledge is very important. In the beginning, you didn't ask me whether I am aware about the reports. Did someone discuss the reports with me? You very nicely asked me regarding my partner's report. I told you no, he has given me a consent, and you has mentioned that it These are normal. What hormonal reports are normal? You need to tell me, okay? So there are certain
Mm,
hormones which are secreted from the brain, like FSH and
mm,
LH. At least take a name, okay? FSH, LH, and
mm,
testosterone. They all are normal, but then there is another hormone which is known as prolactin, which is associated with breast milk secretion. This has raised in your case. So it could be, see, it could be either hyperprolactinemia or it could be either PCOS. As of now, I am not in a position to comment about
mm,
a type of diagnosis, but it is
mm,
anovulation. Hmm?
mm,
Although they had mentioned, see, SHBG is almost on the lower side, and
mm,
anovulatory. It is not totally anovulatory. It is pre-ovulatory. That means in 21 days in a regular cycle, so we may repeat her serum. If you will not listen, go by book. If you will not go by book, if you will just go by the scenario, 21-day progesterone is more than, it is at in the range of 15. So I will take another after weeks also. I will repeat this
mm,
serum progesterone after weeks time to see whether there is any ovulation.
mm,
If it is more
mm,
than 30, that means there is ovulation. Okay. There are high
mm,
chances that since she's having irregular cycles, her ovulation might
mm,
be delayed. Okay. Free androgen
mm,
index, they had mentioned very less. In PCOS,
mm.
the free androgen index is what it is. What is the implication of free androgen index in PCOS?
It is on the higher side.
Yes, it is on the higher side because there is more free
Testosterone.
testosterone, which is hyperandrogenic, and
Mm,
less SHBG. Okay, so
mm,
that's the reason it is on the higher side. But here it is not giving us any clue. So I will
mm,
mention it as a anovulatory cycles. Mostly could be because of PCOS or could be because of hyperprolactinemia. Okay, and then give me a crystal clear plan. Do not confuse me. You confused me, dear. You give me all options. I need to
mm,
lose weight. I need to lose weight. I need to start on clomiphene citrate. I need to go for laparoscopy surgery also. Don't you think that you had given me all the options? IVF, you told me? No.
No, I didn't.
So it is applied clinical knowledge. So the first line of management will be
Mm,
told by you to me with side effects, with
mm,
chances of me getting pregnant, success rate, how long you are
ah,
going to offer me this modality. If not,
mm,
most of the time this is going to work because we have seen that weight reduction and this treatment works wonderfully. But if at all it
mm.
fails, we do have alternative options, something
Mummy,
like add in
mm,
metformin, some injections
mm,
of gonadotropins, okay, so certain injections of the hormonal injections, or what, a surgery, okay, a laparoscopy
mm,
surgery, which is which is known as PCO drilling. Okay, so these are an alternative
mm,
options, but as of now, we will start with the first line of option. And if at all everything fails up, do not lose hope. We do have an option of test tube baby. At that time, we will discuss funding. See, I am here to discuss my management. Why you offered me my husband's quit smoking?
mm,
Patient safety is managing me first, then
mm,
surroundings thing. You didn't give me my clear plan, and you were emphasizing that I need to discuss this street smoking with my husband. Okay, that is little
mm,
irrational. Okay, that is it. See, it is his way. It is his purview. Whether what will be his options. Okay.
mm,
So why do you think I'm struggling to get pregnant? What are our options? Of those options, what you will recommend and why, and what should I be doing? Okay, so introduction was good. Situational awareness, you had it because the clinical reports were absent and
mm,
the test results were printed by someone for you. So aim will be to report discussion. Anxious to get pregnant, acknowledge that very nicely. You had acknowledged that and you had reassured me. Setting agenda, always open question, always open question. Ask about open question, then go closed question. So it is PCOS history, which is very important. Losing, whether she has noticed increased weight gain and increased excessive facial hair. What about her periods? Okay, menstrual history is very important. Sexual history is very important. Any concerns regarding sexual history needs to be addressed then and there. Close question, menarche regular, irregular, irregular,
Hmm.
contraception, weight gain, excess hair, dark skin, tubal history you need to rule out, that is STI and surgery. I will come to that
Hmm.
also. Anybody remember a nice guideline? I will not go to the next slide. Till that time, I will not get an answer. What the guideline says, dear,
Ma'am, about what?
regarding tubal test. Okay, can we give her ovulation induction,
No,
or
no.
we can do a tubal test and then give her ovulation induction?
Yes, yes, ma'am. Tubal without tubal test, we can go for a ovulation induction, but with before IUI, we have to get a test done.
Yes, done. Very nice. Very nice. Anybody agrees with this? Anybody agrees with this? If not, please go and read it.
Yes,
Hmm.
we
If
had
not,
we can give for
Ma'am,
3.
please repeat
for
what.
first three cycles. Okay, Rajni wanted to say something.
No, I just wanted to repeat that point, whatever she told.
Very nicely. Okay. Anybody wanted to say anything?
Yes, ma'am. We have to give for 3 cycles without tube test.
Yes. So
If she
first
is not
first three cycles,
satisfied,
you can very easily give her if there is no risk factor. Okay. Because no STI, no surgery, no PID. So we can very easily give her 3 cycles of ovulation induction with planned relation. Okay. We are not offering her IUI. Planned relation. If meanwhile she fails to conceive, then tube test. Yes. No need to offer tube test straight away. This has been offered in the answer key, but I will not agree with the answer key here.
Okay.
Okay. Yeah.
Hmm.
HOP, okay. Tubal history, STI, surgery, contraception, smoking, we need to ask. Allergy, she was allergic to penicillin. I didn't mention that. Sorry for that. Family history. All the history you has asked me, but this family history of
Hmm.
obesity, diabetes, hypertension was all there present. Okay. Now her history and her partner's history is
Hmm.
BMI, occupation, alcohol, smoking. These are the
Hmm.
important points where we, if it is a funding issue, we might need to address this issue. Okay. Check her
Hmm.
background knowledge for what she has come. Okay. Normal first, then abnormal. Always remember that.
Hmm.
What are the implications? Prolactin raised here. At least when you
Hmm.
notice that the prolactin is raised, you can ask her about breast discharge, headache,
Hmm.
okay, and any visual disturbances. Then
Hmm.
permission to discuss the partner report, and if she says yes, okay. Explain PCOS. If you are thinking
Hmm.
that this is could be PCOS, explain PCOS. Basically, here explain anovulation.
Hmm.
Okay, I will explain it as a mostly delayed ovulation or anovulation.
Hmm. Hmm.
And due to either PCOS
Hmm.
or prolactin.
Hyperprolactinemia.
Yeah, we do not know. Okay.
Ma'am, whether we will repeat the text of the prolactin or not.
Yes, we had come to that also. We had come to that also. So now implications will be anovulation, probable cause, but hyperprolactinemia is also a concern, needs repeat prolactin. And if it is high, then what will be your treatment modality? Capgolin.
Hmm.
Okay. And if
Hmm.
it is high, then the treatment for the same, which will revert back her and ovulation, an ovulation. Okay. So this here you can involve means consultant only. Okay. Fertility specialist or
Hmm.
consultant. Because if it is less than the stipulated, means there are, if it is more than thousands range, then definitely you're going to involve the endocrinologist, you're going to offer her MRI. In this case you are just going to repeat it if it is the similar way. Okay,
Hmm.
here only,
Hmm.
then that treatment will be
Hmm.
offered to her in the form of tablet capgolin. Okay, you can mention the name of the cabergolin also.
Okay. Hmm.
Okay, no need to explain the doses, but this is one point which we need to mention, either because of the PCOS or Capgoli, and ask whether she is aware about PCOS, whether she is aware about anovulation. Anovulation means the US ultrasonography, and even you can offer her ultrasonography. The ultrasonography
Hmm.
has not been offered. Okay,
Hmm.
okay. So rather than tube test, I will offer her ultrasonography. Okay.
Okay.
Yeah, so this needs to be offered. Now treatment is lifestyle, exercise, which will aim to minimize her BMI less than
Mm,
25, because it will increases the chances of spontaneous ovulation and spontaneous
mm,
pregnancy. Diet, dietitian, weight watcher, slimming burn. There are multiple group exercises if she's finding it difficult.
mm,
It also helps her to minimizes the long term implication of high BMI.
mm,
Inform consultant and inform fertility specialist. Here I had mentioned symptomatic for prolactin plus capgolin tablet after repeat PRL and prolactin I had mentioned here. Ovulation
mm,
induction is a drug of choice in her case with plant relationship. Pros and cons. So she can have some side effects like nausea, vomiting, or some visual
mm,
disturbances. But chances of getting a successful pregnancy is very high.
mm,
Uh, at the same time, the risk will be multiple pregnancy and OHSS, which you had mentioned. If failed,
mm,
then only next line of mention, next line of modality, what you
mm,
need to explain. Tube test, if no conception after 3 cycles. IVF will be the last resort if criteria meets.
mm.
That also you have to mention. PIL or PCOS, hyperprolactinemia also you can mention here. Okay.
Ma'am, like we give 6 cycles of ovulation
After
induction.
3 cycles, yeah, but after
After
three
three
cycles, we
cycles,
are going
tube
to do the tube
test,
test.
and
If it
then
is pendant, again
mm,
you are restarting her on
mm,
ovulation induction.
ovulation induction.
Counselor
Mm,
is a part of fertility domain. Okay, so offer her counseling, avoid unnecessary delay in her care, document and
mm,
close the loop.
mm.
Okay, so
Okay,
this way
ma'am.
we are going to, yeah, we are going to complete it.